Well, my name's Gideon. My surname is Byamugisha. I am a Ugandan. I'm a teacher by profession and a pastor by calling. I am known in the world as someone who has devoted his life to fighting HIV and AIDS-related stigma and the associated shame and denial and discrimination, which breeds inaction and misaction, which are 6 related evils that are critical in frustrating the global efforts against HIV. I lost my first wife to HIV in 1991, so I married again in 1995 to Pamela, who was already widowed by HIV herself at a very young age of 25. Because we were both positive, we were not able to have children immediately. We postponed having children. But when science came about prevention of mother-to-child transmission prevention, so we put the science into practice and had 2 babies, actually. One is now 10 years, another one is 8 years.
What do you mean by stigma, and how does that fuel the HIV epidemic?
People are shunned, shamed, prejudiced on account of who they are. It's a negative connotation you give someone whom you think they are different from you, and you tend to think they are to be blamed for their condition. Well, the stigma around HIV comes from 4 sources. The first one is people fearing contagion. People tending to think that if you come near someone who is positive or eat with them or shake their hands, you are likely to get infected. So people stigmatize you. You know, if you are in a church, you sit and people move away. Or if you are coming to go for Holy Communion, people want to take the cup before you, or that day they absent themselves from taking Holy Communion because they tend to think they may pick the virus from sharing the same cup. That's one source. The other source is when people tend to think that because you are HIV positive, then you are going to die quickly. So people refuse you food. Why should you waste food to someone who's going to die? Why should you take them to school? You know, so that source also is there. But there is also a stigma that comes from associating HIV with immorality, with sexual deviance. Not actually sexual deviance. All things that community thinks are deviating from the norm. So injecting drug use, or homosexuality, or prostitutes, or truck drivers, people whom society thinks they are not the norm. Now, these days we are getting another stigma. So if you say I'm positive, some pastors would say you don't have enough faith. You should be saying, in the name of Jesus, I am negative. And that goes also to taking ARVs. When they find you taking medicine, they say, oh, so you don't have faith that believes in miracles. Why take ARVs? Throw them away. So people who are taking medicine and are people or leaders of faith are stigmatized. Since we now know the sources of stigma, then the church leaders and the church communities can identify those sources and fix them one by one. If people are stigmatizing us because they fear being infected by shaking our hands, what should church members do? Hug, show love, care for people, and people will learn and say, hey, so you can hug someone, so you can care for someone. The biggest disadvantage of stigma in HIV prevention and treatment, because people fear to know, because they know if they test and then people come to know about it, The stigma may even start from the testing center. Hey, so-and-so came here. Did you see him? Did you see her? So people distance themselves. But also they fear if the repercussions of knowing that you are positive, when you know that people are going to disown you, they are going to shame you, they are going to discriminate against you, and so forth. So people shy away. Even those who attempt to test, many times they don't pick the results. And when they pick the results, they don't disclose. They keep quiet. The wife doesn't know, the husband doesn't know, the spiritual advisor doesn't know, the health provider doesn't know. So what has the test done? Nothing. Very crucial, because if you don't focus on stigma, you lose on two fronts. You lose on prevention. You also lose on treatment. You can't win. When people go for treatment, it's already too late. They have been postponing. You know, I've seen it in Uganda. People start. The wife says, "Why don't you go?" No. I will be okay. You know, by the time they fall down, the TB has eaten 3/4 of the lungs. If there was no stigma, this person would have gone quickly, tested, started treatment, because TB is treatable. The moment you talk about safer sex, people talk quickly, their mind thinks safe scene. For example, when they see me buying condoms, they say, hey, so the man is going to commit adultery. Safe sex is associated with unfaithful, unlawful behavior. Yet, what safe sex really means is that if you really love me as your husband or as your wife, then you should be interested in my safety. And the first thing we do before we have sex together in marriage, we should test for HIV. If one or both of us are positive, we should use condoms throughout. If we want to make a baby, but we are positive, then we go and consult the health practitioner, the medicine people who know, who can teach us how to do it. If we don't know each other's status and we are married, that is a very unsafe thing to do. We are faithful together, but we are very unsafe to each other. You don't know my status, I don't know your status. So we are going to, either I'm going to infect you, or you're going to infect me, or we are going to infect our children. So it's not about having sex before marriage or outside marriage that is causing AIDS. No. What is causing AIDS is having unprotected sexual intercourse with someone who is positive. Whether that is before marriage, or within marriage, or after marriage. The one of people fearing death, the church community members can bring people who are positive and are long-term survivors to speak to the congregation and say, you were thinking that people die early. Now look at this man. He's now a member of parliament. He's now a bishop in his church, and he's positive. And he knew it 20 years ago. So don't mistreat, don't abandon your loved ones who are positive, because they can live, when you give them love, care, and support, they can live long enough. They can be productive in their community. I think I have a message. God has given us enough information and science that can help us defeat this epidemic. What we need to do is to work together, strengthen our partnerships so that people can have knowledge, skills, attitudes, and supportive policies to do what they need to do. Then we can accompany each other on this journey to reduce the stigma, but also to increase the safe practices, the access to treatment and the nutrition, the testing and the counseling, and the empowerment of children, of young people, of men and women, of communities and nations that are very vulnerable to this epidemic. And God has told us, when we do what we can, God does what we can't.